Dr. Russell. I'm Laura with the Arctic Sun, and I wanted to see if you just had a couple minutes for me to pick your brain about temperature management in the neurocritical care patient. Do you have a few minutes?
Yeah, I have about 5 or 10.
Okay, great. Thank you so much. I don't know if you know this or not, but the hospital currently uses the Arctic Sun for sudden cardiac arrest patients down in the MICU, but I just kind of wanted to pick your brain about temperature management for your patients. Right now, in all of the neuro ICUs around the United States, they utilize, about half of them are utilizing the Arctic Sun. But what are your thoughts? What do you do for your refractory fever patients here in the neuro ICU?
Well, I order Tylenol, and if that doesn't work, I'll go ahead and the nurses will apply a water blanket.
Okay. And does that work most of the time for you?
I think so.
Okay. Do you ever have any patients where you've tried Tylenol and you've tried water blankets and nothing's working to bring that fever down?
Yes, sure do.
And what do you do for that patient?
Keep using water blankets. Pack them in ice. That's what the nurses are doing.
Okay. Do you think that has any effect on the patient by letting their fever continue to escalate without being able to get it under control?
Yeah, it does. But that's all we have.
Okay. And and that's what we hear a lot. And I wanted to just kind of go over a few things with you from what we've seen in other neuro ICUs and just get your feedback on that.
Okay.
So this is a simple graph based on, if you look over here on this axis, it's based at patient's temperature. And down here, it's in hours, so it's time. So let me see, tell me if this is something you're seeing in your neuro ICU. A patient comes in there febrile, first thing you do is you give them Tylenol. So that's what they're doing in the other hospitals too. Within 2 hours they'll give them Tylenol, and then if the fever still persists 4 hours, 6 hours later, and they've got that uncontrolled hyperthermia, they've tried blankets, they've tried Tylenol, nothing's working. At that point they'll utilize the Arctic Sun to bring that patient's temperature down. And so another picture that better describes what we're trying to do is we're not talking about throwing pads on willy-nilly on every patient that has a fever. It's just that subset of patients that nothing else is working for. So this is another way to show what we're talking about here. First hour to 2 you do Tylenol, after that water blankets, but it's this subset of patients up here where the Arctic Sun is applied and then the fever is broken. What are your thoughts on that?
That would certainly help our patients. Like you were just saying, Laura, just those few patients that have that difficult fever to break.
Right.
Yeah. So you're talking about using the Arctic Sun.
Yes, the Arctic Sun for those patients, after you've done that stair-step approach, then trying the Arctic Sun for those. And let me just give you an example of a case where this was utilized here in Houston. And just to give you kind of some background on this patient, this was a subarachnoid hemorrhage patient. She was an African-American lady, 36 years old. She was a mother of 3.
Oh, my goodness.
Or she is a mother of 3, I should say. She has hypertension and diabetes, which is evident also in her father and her mother. But what happened was she was at home with her kids over summer break, and she collapsed. She said she had a severe headache and she collapsed. And her daughter called EMS, and they got there within 10 minutes. And but this is a view of her case. So a couple of things, if you'll see here. I don't know if you can see. Can you see this well?
I can see it. Thank you.
Everything in yellow corresponds to the patient temperature, and everything in blue corresponds with the water temperature. And this dotted line here is the target temp. So a couple things to point out. Whenever they started the Arctic Sun, her temperature was 39.06 degrees. It's very precise.
Sure.
And the water temp was all the way down at 5 degrees Celsius, which you can see over here, and the target temp was 37. And as you can see, and this is the whole case time, which was about 3.5 days, and as you can see, as the patient's the patient's temperature goes below target, the water temperature responds to bring the patient back up to target. You can see there's close tightness here, but the machine is working really hard. I'm going to go to the next slide because this is the whole therapy, and we're going to break it down day by day. So you can see she started up here around 39. She came down, she overshot a little bit, but the water corrected pretty tight here. When you see all those water fluctuations, it means the machine is working really hard. Green down here is go, red is stop. So you can see as the patient came down, therapy was stopped. And we don't know if it was for CAT scan or what it was for. One thing that's really helpful, though, for your patients is that the machine also can help determine if there's fever burden. The patient is very close to target, but you can see as the patient starts to spike a fever, the water responds. That's what we call fever burden, and you can see it here and here. So it lets you know if the machine's still trying to fight that fever. And then lastly, you can see the target temperature was changed. They hit stop, and at this point, the nurse forgot to hit start. But that's the precision that the Arctic Sun can show you with every patient case that you have. It has the ability to capture that data.
So do we have those devices
You
in-house?
do in the hospital. You do. You've got the pads and the devices, so all you would have to do is just request it if you have one of those patients. And at this point, though, what can we do to help you?
Well, you know, I would love to at least try and use the device on one of our patients.
Okay.
Yeah, I would love to try it.
Sounds great. Well,
Yes.
we can have a device brought in for you if you want one specifically for neuro, which I would suggest because they use it a lot down in MICU. It might be hard to get your hands on one, but we can get one shipped in just for neuro ICU, and let's capture some of that data and just let you see.
Well,
how
could
it
I
works.
borrow it from the unit and then?
You can certainly try.
Okay.
Absolutely.
I'll try that then.
Well, thanks so much
Thank
for
you,
your time. I
Laura.
appreciate
Thank
it.
you.